It can be among the most helpless of feelings for a parent. Your child is sick. It might be an ear infection, it might not. But how do you know? And how do you know when it's time to go to the doctor?
How are your ears feeling today?
Dr. Alan Bruns is a popular guy with the under 10 set. As an ear, nose, and throat specialist at Essentia Health, he's peeked into a lot of little ears on the lookout for infection. Infections often happen following a cold or virus when the eustachian tubes get blocked. Air is unable to reach the middle ear, which creates a vacuum which pulls fluid and germs from the nose into the middle ear. The fluid is unable to drain from the swollen tubes, becoming a perfect breeding ground for bacteria or viruses to grow into an ear infection. Bruns says 90% of children will get at least one ear infection growing up.
In younger children, they have a shorter eustachian tube. It tends to be a little bit more horizontal, and oftentimes there's a hereditary component to this as well, where it just doesn't work as well as it should.
Dr. Bruns says when the ear gets infected, you'll notice the child pulling on her ear. She might not sleep as well, be irritable, and have a low-grade fever. Typically, you can treat the infection with Tylenol and warm compresses to ease the pain. He says it makes sense for parents to try what he calls watchful waiting to see if the child is fighting the illness or needs immediate attention.
And that's one of the things a physician will look at in terms of, do we give antibiotics or not? How sick is the child? If the child is just a little irritated and irritable, then probably waiting a few days is not necessarily a bad thing. But if all of a sudden that they have this fever and they're just really not doing well and a sharp shooting pain, oftentimes those are patients that would benefit from an antibiotic.
Most children can fight the infections with antibiotics, such as amoxicillin or Augmentin, but some will need more drastic measures. Dr. Bruns says if a child has her first ear infection before the age of 1 or had 4 or so infections in 6 months, they would consider surgery to insert pressure equalizing or PE tubes to help with the drainage. He says as children grow, the tubes will come out on their own, and 80% won't need another set. For Essentia Health Medical Insight, I'm Tracy Briggs.